Hi everyone, I'm Dr. Jaclyn and I'm a general dentist with Dental Designs Singapore. So in our clinic, we generally offer two big categories. One is what we call fixed braces, where the braces are attached to your teeth. And the second group is clear aligners, so something like Invisalign, where the braces are not attached to your teeth all the time and they are removable. Let's talk about the fixed braces category first. Generally, you can divide fixed braces into two types. One is metal braces and the second type is ceramic braces. So metal braces are basically the good old traditional type that you may have seen, or you may have had this kind of treatment when you were a teenager or a child. So it consists of a system of metal brackets, so the little squares that are glued onto the teeth, and these squares are individualized for that particular tooth. And the brackets are connected with an arch wire. Ceramic braces are pretty much the same, but the squares are made from ceramic, so they usually are tooth colored. They look less obvious than metal braces, but the ceramic brackets are more expensive and they are more fragile because ceramic is brittle. But the same as metal braces, the ceramic brackets are connected with an arch wire. So in essence, metal and ceramic braces work in the same way. The end result is pretty similar. You shouldn't be able to tell if a patient was treated with metal or ceramic braces at the end of the treatment, but it's just how you're going to look during the treatment. And of course, ceramic braces, they do cost more and they're a bit more fragile. So some patients may not be as suitable for ceramic braces. For example, if they grind their teeth, they may tend to damage the brackets more easily. The next category, which is clear aligners, so something like Invisalign, they are removable. Basically, it consists of a system of plastic trays that are customized to fit your teeth. And each tray is slightly different from the preceding one. So the trays actually squeeze the teeth like from the outside to get the teeth into the ideal alignment. If you compare fixed braces and Invisalign, fixed braces are much more versatile because they are glued to the teeth all the time. They don't require so much discipline to remember to wear the braces because they are on your teeth all the time and they are working 24/7. For Invisalign, it demands a much higher level of cooperation and discipline from the patient. If you're not consistent with wearing your aligners, obviously the teeth are not going to move. And because of the way aligners work, there are certain movements which are just more difficult for aligners to achieve as compared to fixed braces. So clear aligners, in my experience, they're pretty good for patients with very mild misalignment. Maybe you had braces when you were a child and you didn't wear your retainer and most of the teeth are in pretty good position and you just need a little bit of correction of the relapse. For patients who have not really had previous orthodontic treatment when they were younger and they are coming in to start comprehensive treatment as adults and the crowding is quite severe, or you may need extractions, I feel that fixed braces would be more efficient and more appropriate to get you to the end result in a more efficient way. But as with all things, this is a discussion that you have to have with your dentist or orthodontist because every case is different. You have to have an individualized treatment plan that is just formulated for you based on your goals and your starting condition. I look forward to seeing you at Dental Designs really soon. Bye!